Energy Media readers, I know from social media that a lot of you are paying attention to Alberta Premier Jason Kenney's recent comments on CBC that the Alberta government intends to do a bit of an end run around Health Canada and look to other credible jurisdictions that have done tests or either have developed tests or have tested drugs, and Alberta would use that as their measuring stick in terms of approving it within the province. That's a lot of doctors are not happy with that, and to have a discussion about it, I've joined by Professor Tim Caufield of the University of Alberta. So welcome to the interview, Tim.
Thanks for having me on.
Now, just give me your response to the Premier's comments.
I don't think it's a good idea. And when I first saw it, I was frustrated. You know, I think for a couple of reasons. You know, first of all, it's not clear from even a jurisdictional perspective how this would play out, right? How is it going to play out? Are they just going to ignore Health Canada, which they have jurisdiction over the approval of drugs and devices, or are they just going to ignore that power and go ahead with the using of these devices, whether you're talking about a test, whether you're talking about a drug? And he also mentioned vaccines in that message, right? So is he just going to ignore the framework that we have right now? So how is that going to play out, right? So I think that's problematic from a sort of a legal jurisdiction perspective, but it's also kind of problematic, I think, from a messaging perspective. You know, he's telling Canadians that we can't trust Health Canada. And so unless you have a really good reason for that, to back it up, I'm not saying that we shouldn't question authority, but unless you have a really good reason for backing that up, not a great message right now, right? We don't want to erode trust in our central public health entity. And lastly, one of the things, you know, it's an area that I actually research. I'm really frustrated with what's in the implication here. So he's kind of implying that there are effective drugs, you know, potentially effective vaccines, you know, effective tests that are not available, that aren't being deployed because of, you know, bureaucracy. Right? You know, that's basically what he's arguing, and that's exactly what we heard from people like Trump, for example, around the malaria drug, when it's proved to be a huge error. You've got to let the science play out. We have these regulatory frameworks for a reason, and you've got to let them play out.
And it seems to me, as a non-expert, I mean, I do follow the Johns Hopkins data, you know, a couple times a day to see how many infections we've got and what our mortality rate is based on the data that we have. And compared to other countries, with the caveat that the data is not great, but nevertheless, we seem to be doing pretty well. And in BC and Alberta in particular, we seem to be flattening the curve, which was the objective. So there doesn't seem to be any particular, you know, raging crisis that needs to be addressed in this way.
This is my impression also, and I've been following it, you know, very, very closely, and I've been pretty impressed with both the federal public agency, you know, the Public Health Agency of Canada, and our provincial ministry. I've been pretty impressed with our public health organization here in Alberta, and really across the country. Have there been, you know, things that haven't been ideal? For sure. But in general, given the uncertain nature and the evolving nature of the science, pretty impressive. So what is the huge folly, the huge error that has prompted this pushback? You know, I worry that this is political positioning. You know, they're seeing the end, and now they want to use this situation. I hope this isn't the case. Maybe this is a cynical view, as an opportunity for a little bit of political positioning. And I really hope that's not the case, because it's not the time for that.
Well, and to speak to that argument, he also took a shot at Dr. Theresa Tam, you know, Canada's chief medical officer, and her, you know, accused her of basically repeating China's COVID-19 talking points. That's pretty purely political from my point of view.
Yeah, I was really kind of mad at that point. I've been very impressed with her, and to be fair, and in full disclosure, I know her. I've worked with her on other issues. That was kind of aggravating, because he was implying if you're a scientist and you change your mind, somehow you're wrong, That's, that's was his implication. That's not how science works at all. What she's doing, and her organization, she's not doing this on her own. They're, as best they can, they're aggregating the scientific information as it emerges. And you want public health authorities to be nimble and to respond. That's exactly what you want them to do. And to sort of hold that in their faces as demonstration that they were wrong is kind of frustrating, because she's responding exactly as you'd want a public health official to respond.
So Tim, last question, and this is my observation. Tell me whether you think I'm accurate or not. But it gets back to something you said earlier in the interview, which is that our institutions, our policies, our personnel, and so on really seem to have functioned pretty much and performed pretty much as we would have expected to. We are institutions and everything, with maybe some fine tuning, but they've done okay. And especially when you look compared to Italy and Sweden and the United States, where the response has been not as good.
I've been impressed, and I've been impressed not only with our institutions, but with the citizens. You look at how people are responding. I rarely go out. Over the past month, I've rarely been out, but really impressed how people are respecting the social distancing and the effort that people are making. And this is hard on people. And Albertans are stepping up. They really are. So I've been impressed with our institutions. Yes, we're going to learn from this, and we're going to be better next time. And I've been impressed with the people of Alberta.
Yeah, I think that's really true. I mean, we keep seeing stories come out of the United States. There was one today about a protest in Michigan over the governor's lockdown order. We've seen, and there's still 8 states in the U.S. that don't have lockdown orders, that don't have any kind of direction to citizens to self-isolate and quarantine and so on. And we haven't seen that anywhere. I guess maybe Ontario and Quebec to a little bit of extent because they seem to be lagging behind a bit, but not that much.
Yeah, it's been really impressive, and I hope we learn from this, right? I hope when some of the legacy that we get from this is that we understand the importance of good science. We understand the importance and value of having health institutions that you trust, right, and that you can turn to. And I also hope we understand how important it is not to allow misinformation to spread, and not to have your political officials be part of that misinformation problem.
Tim, thank you very much for this. Really appreciate it. And given that the pandemic isn't going away tomorrow, I have no doubt we'll be talking to you again in the near future.
Well, thanks for the opportunity.